Now, you might want to know the differences between joint dislocation and when they say a joint is subluxed. Okay, so joint dislocation and joint subluxation, they are quite different. So it's good that look at the differences between them. So let's quickly look at the subtle differences. Let me pick up my pen. This is what we say a joint subluxation. This is what we say a joint dislocation. So to me, to my best of ability, joint subluxation, right? The joint is not intact, but it's not out of its space yet. While for joint dislocation, it's completely out of its space. It's in another place. Let's discuss. Okay, the literature will shed more light. So joint dislocation, we said that it's a complete separation of two articular surfaces. It's more serious. The joint surface lose all the contact. It's moving out to another place. Can be caused by traumas, can be caused by sports injury. So there's severe pain and swelling, there's visible deformity, there's inability to move the joint. So to say, the person is losing a lot of function there. You understand? So treatment is urgent reduction. They can immobilize. That's like they shift the joint. That's the other bone back to its space. Then make it that you are not able to use that, move that part of the body for a while, so that you can recover. Then they also give a lot of pain management drugs. Okay, acetaminophen, you know, ibuprofen, and the rest of it. So for joint subluxation, it's a partial dislocation. The bones are misaligned, but they are still in partial contact. Do you understand? It's not where it is supposed to be, but it's still partially within the space. Okay. So it's less severe than dislocation, but can still damage the ligaments, the tendons, the cartilages around there. If blood vessels are close by, it can damage them. If the nerves are close by, it can also damage them. Causes is traumas, congenital joint laxity. So it could be that normally your ligaments are not just strong. Okay, congenital ligament laxity. I mean, then sometimes connective tissue disorders. Okay, like all those tendons that are supposed to keep the joint intact. They are soft. Then so symptoms, there's a lot of pain. There's swelling. There's you are feeling like that place is unstable, you know. And sometimes if you try to move that part of the body, you hear audible sounds like poop, 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 poop. So treatment is manual reduction, bracing of splints, physical therapies, and sometimes surgery if the thing keeps coming back and back.